Hi, my name is Danielle Hausman. I'm an occupational therapist and rehab educator here at the Craig H. Nielsen Rehabilitation Hospital. Thank you so much for watching this video about understanding what is Guillain-Barre syndrome. Please take a moment to pause the video and read this important disclaimer. Thank you. Here are the objectives that we'll discuss in this video. We want you to understand what Guillain-Barre syndrome is and be familiar with the typical recovery pattern. So what's in a name? Most commonly, you'll hear Guillain-Barre syndrome referred to as Guillain-Barre syndrome or, more simply, GBS. But here you can see a list of terms that other providers might use to refer to GBS. Who can it affect? Really anybody. It can impact men or women, children and adults, people of all ethnic and racial groups, and it's a very rare neurological disease that impacts only about 1 in 1,000 Americans. The exact cause of Guillain-Barre syndrome is not completely understood, but we do know that commonly it will follow either a respiratory or a gastrointestinal infection. Sometimes it also occurs after receiving vaccines, having an insect bite, or during pregnancy. What are the effects? So Guillain-Barre syndrome is an autoimmune disorder, meaning that it's an abnormal or an overreaction of the immune system, and the immune system mistakenly attacks the healthy nerves. Specifically, it's damaging the peripheral nerves. The peripheral nerves are the nerves that live outside of the brain and spinal cord, and this impacts motor functions, meaning the ability to move your muscles, sensory functions, feeling, touch, temperature, pain, knowing where your body is in space, and also autonomic functions such as regulating your heart rate and your blood pressure and your ability to go to the bathroom. And it's impacting the myelin. The myelin is the fat and protein coating that insulates the nerves. And in some cases, the damage goes deeper down to the axon, which is the main part of the nerve fiber. The most common onset pattern usually begins with some weakness and changes in your sensation, starting with the bottom up. So feeling weakness and sensory changes in your legs, followed by the arms, neck, and then finally the breathing muscles. And it doesn't always impact everything. For example, it might impact some individuals only in their legs, or sometimes the legs and arms, but sometimes it does go all the way to those breathing and respiratory muscles. But there also can be many other presentations, particularly when the cranial nerves are involved. The cranial nerves are the nerves that are in your brain, and this can result in drooping of the face, difficulty with swallowing and talking, and also vision problems. So the peak damage usually happens at around 1.5 to 2 weeks over a 3-week total period. And what happens is the muscles weaken because of that myelin loss. And after the myelin damage has peaked out, we know that it's a very slow healing process, that the nerves do have the ability to repair themselves and regenerate that myelin, but it's a very slow process, slower than anyone wants it to be, but strength and feeling do slowly return. The analogy we like to use is that of an electrical wire. So nerves communicate through impulses like an insulated electrical wire. And if part of the nerve insulation is damaged, such as if the insulated electrical wire is damaged on the insulation, the electrical wire will short. And in this case, the nerve will short without that insulation from the myelin. So the typical recovery pattern is usually the reverse of the onset, but this can look different from person to person. So arms usually will regain strength and sensation first, followed by the legs. So again, we know that the body does have the ability to reproduce the myelin, but it can take weeks and sometimes even months to heal. And this can take even longer when the damage has gone deeper down to the axon. The most important concept during your recovery is the concept of energy conservation. So while we wish that it did, therapy does not have the ability to repair nerves. And when recovering from Guillain-Barre syndrome, if you overuse your muscles and exercise to the point of exhaustion, we know that recovery will actually take longer. And in the long run, this will delay the process. So it's so important to pace yourself and take frequent rest breaks. That it's okay to feel tired the next day, but if your muscles actually feel weaker, that's a sign that you overdid it. So oftentimes, time and supportive care are the only necessary treatments. And your therapist will work with you to make sure that you're maintaining your range of motion. In other words, your ability for your joints to be able to move through their full motions to prevent what we call contractures, which means your muscles tightening and then your joints getting fixed in a certain position. But sometimes other treatments are also indicated, such as IVIG and plasmapheresis. You may have already had some of these treatments, but if not and you're curious, please talk to your healthcare team to see if they would be appropriate in your case. But again, oftentimes time and supportive care are the only necessary treatments. So to summarize, we know it can be frustrating, but the exact cause of Guillain-Barre syndrome is not known. The nerves are damaged, but the myelin has the ability to repair itself, but it takes a long time. And recovery can be supported by rehabilitation, sometimes medical treatments, but lots and lots of rest. As always, please contact your primary care team with any questions that you may have.